This presentation is brought to you by the University of Tennessee Health Science Center and Regional One Health. Let's talk about the pneumococcal vaccines in adults and why they're so important to offer to our patients. Pneumococcal disease is the second most common cause of vaccine-preventable death in the U.S. This usually comes in the form of pneumonia, bacteremia, or meningitis. Here's a list of conditions that put patients at risk of having invasive pneumococcal disease. These include functional or anatomic asplenia. We commonly think of sickle cell disease in this case. Also immunocompromised. There are a number of medical conditions we often associate with invasive disease, such as chronic diseases of the kidney, heart, lung, and liver. Alcohol abuse and smoking are also related to invasive disease. Finally, patients with cochlear implant or CSF leak are at significant risk. Let's move on to the currently approved pneumococcal vaccines. First, we have the pneumococcal polysaccharide vaccine, PPSV23, that goes by the brand name Pneumovax. This vaccine protects against 23 different serotypes of pneumococcal bacteria. It's been shown to be 60 to 70% effective in preventing invasive disease in immunocompetent patients and those with underlying illnesses. Next, we have the pneumococcal conjugate vaccine, PCV13, that goes by the brand name Prevnar. This vaccine has 13 serotypes of strep pneumo conjugated to a non-toxic diphtheria carrier protein, CRM197. PCV7 has 7 serotypes and was first licensed by the FDA in the year 2000. PCV13 was shown to be immunologically non-inferior to PCV7 and replaced PCV7 in 2010. PCV7 was shown to be 97% effective against invasive disease caused by the serotypes in the vaccine, and this was thought to be true as well for PCV13. This is a detailed table covering the indications for the currently approved pneumococcal vaccines. If there is no specific medical indication, PPSV23 should be offered to all adults 65 years of age or older. PCV13 is no longer routinely recommended for this age group, and offering it should be based on shared clinical decision-making. If PCV13 has been given, PPSV23 should be given at least 1 year later. There are 2 groups of indications in immunocompetent patients with intact spleens. The first includes patients with alcoholism, chronic diseases of the heart, liver, and lung, cigarette smokers, and those with diabetes. All of these patients over the age of 18 should receive PPSV23. They should also receive PPSV23 at the age of 65 if it's been at least 5 years since the last dose. Similar to the previous category, PCV13 is not routinely recommended to those 65 years of age or older, but if given, it should be followed by PPSV23 at least 1 year later. The second group of immunocompetent patients with functioning spleens includes those with cochlear implants and CSF leaks. These patients should be offered PCV13 routinely if they're over the age of 18, and this should be followed by PPSV23 at least 8 weeks later. PCV13 should be offered at the age of 65 years or older if they have not been previously vaccinated, and it should be again followed by PPSV23 at least 8 weeks later, or if it's been at least 5 years since the last dose before age 65. Patients with congenital or acquired asplenia, or those with sickle cell disease or other hemoglobinopathies, should receive the same vaccine schedule as those in the previous category, except that they should be revaccinated with PPSV23 if they're between the ages of 18 and 65. Immunocompromised patients are those with chronic kidney disease, congenital or acquired immunodeficiencies, malignancy, HIV, Hodgkin's disease, iatrogenic immunosuppression, leukemia, lymphoma, multiple myeloma, nephrotic syndrome, and solid organ transplant. These patients should also receive PCV13 if they're over the age of 18, followed by PPSV23 at least 8 weeks later, and revaccination with PPSV23 5 years after that. At the age of 65 or older, these patients should receive PCV13 if they have not been previously vaccinated, followed by PPSV23 at least 8 weeks later, or if it's been at least 5 years since the last dose before 65. This slide has similar information in a different format, so you can pause at any time to review further. The information at the bottom half of the slide pertains to adults over 65 without immunocompromise, CSF leak, or a cochlear implant. One thing I'll bring your attention to is that if a patient has received PPSV23 at 65 years of age or older and later decides to get PCV13, this vaccine should be given at least 1 year after PPSV23. This slide again shows similar information in a different format, so pause if you want to review further. The information here pertains to patients with chronic medical issues, functional or anatomic asplenia, or immunocompromised state. These are the adverse reactions associated with pneumococcal vaccines. With PPSV23, local reactions are common. Fever, myalgias, and severe adverse reactions are rare. For PCV13, local reactions are common but highly variable. Note that fever and myalgias are much more common with PCV13 than with PPSV23. Febrile seizures have been reported with PCV13 but with rare incidence. Severe local reactions have been reported at 8% with PCV13. Contraindications to the pneumococcal vaccines include severe allergic reaction to vaccine components or following a prior dose of the vaccine, as well as moderate or severe acute illness. This concludes our presentation. We hope we have provided useful information that will help us continue to give the best quality care to our patients.